Hi, my name is Sabine Meurs, and I'm an undergraduate student in biomedical engineering at the University of Michigan, working in the Sabine lab. Today, I'll be presenting on tuning ultrasound-driven bubble dynamics and acoustically responsive scaffolds using 3D printing. Due to their biocompatibility, hydrogels are often used in regenerative medicine for the delivery of cells and bioactive payloads, such as growth factors, as you can see in this schematic. Currently, physiochemical properties of biomaterials, such as stiffness and release kinetics, are preset. This means that post-implantation, these properties cannot be modified if needed. This then limits the personalization of therapy. Our lab has developed a composite hydrogel termed an acoustically responsive scaffold, ARS, which is the term I'll be using for the rest of the presentation. An ARS consists of a phase shift emulsion embedded in a hydrogel matrix. This setup enables an on-demand and spatially temporally controlled delivery using focused ultrasound, as you can see in the schematic below. This is achieved upon exposure to ultrasound when the emulsion undergoes a process termed acoustic droplet vaporization, which disrupts the morphology of the phase shift emulsions, thereby releasing payloads initially encapsulated within the emulsion. For our purposes within tissue regeneration, ARSs have been used for the controlled release of pro-angiogenic molecules to stimulate blood vessel growth. Similar to conventional hydrogels, ARSs have been polymerized using bulk polymerization techniques. This means that a polymer solution is cross-linked, containing emulsions to yield the solid like ARS. There are inherent limitations with this approach, a primary one being the form factor of the ARS is dictated by the shape of the container. For example, a well plate as seen in the image below. This ultimately limits complex patterning of emulsions and patient-specific personalization of therapy. To overcome these limitations, we investigated how 3D bioprinting can generate ARSs with complex form factors and intricate patterns of emulsion. Bioprinting enables the production of customized ARSs where shape, layering, and print pattern can be determined in a CAD model. As you can see in the schematic below, we're comparing the CAD model with the final 3D printed model. Bioprinting enables the construction of complex ARS structures, such as a vascular print, that best suit patient needs. This cannot be done in conventional methods where the shape of the ARS is limited to the shape of the container. A more clear view of how bioprinting occurs is seen in the schematic on the right. In the schematic on the left, you can see that bubble response is affected by the mechanical properties of the surrounding gel. In constructs with a uniform elastic modulus, the morphology of generated ADV bubbles would continue to grow, similar to a conventional bulk technique. However, in the vicinity of a rigid wall, microjetting or asymmetrical collapse of a bubble can happen. Notably, bioprinting enables patterning of PSEs in layered ARSs with different rheological properties. As you can see on the schematic on the right, to observe these dynamics, we are printing a rigid alginate layer on top of an emulsion-containing fibrin layer. The different mechanical properties significantly impact the acoustic response of the bubbles and therefore provide a unique platform to spatial temporally control growth and collapse of ADV-generated bubbles and release kinetics. This depends on a number of factors such as distance from the rigid layer, bubble size, and rheological properties of the bilayer. In this slide, we have a visual representation of the acoustic responsive bubbles in bright field images, with conventional monolayers on the left having spherical bubble formation, while in contrast, bubbles collapse asymmetrically near a rigid layer in the 3D printed bilayer. There is a significant difference in the area of ADV-generated features in a uniform construct versus a bilayer construct with varying mechanical properties, as you can see in this graph. Looking further into a time-dependent area measurement, uniform constructs versus bilayer with varying mechanical properties, we can see the features generated in a bilayer with a rigid layer do not grow over time. This indicates that these shapes are fluid-filled, whereas in the uniform constructs, the bubbles grow significantly because they are gas bubbles by principle of passive diffusion. Lastly, in these images, we can see that integration of bioprinting with ADV enables control of bubble dynamics, and in return, release kinetics due to potential collapse of the bubbles and the macropore formation. I have attached a QR code for our paper in bioprinting. If you would like to read more about this topic, thank you so much.